When patients are likely to have a diagnosis of Parkinson's disease, it can often be a daunting prospect in giving them that information. There's a number of challenges which you face both as a clinician in order to deliver that information in a way that the patient can understand in a sensitive manner, and also establish at that time what the patient wants to know. Therefore, often in delivering that information, it's important to, again, understand of what the patient understands is already going on. Some patients, when receiving the diagnosis, may already have a strong suspicion that this is what's going on and may have already prepared for it. Other patients, this will come as a very significant shock, and therefore the delivery of that diagnosis needs to be in a sensitive manner, understanding what the patient wants to know, already understands, and often that can mean giving some information initially around the diagnosis and then promptly following them up either through seeing them again or through the Parkinson's disease nurses to allow them time to digest that information around the diagnosis and time to think of questions that they would want to ask about it. I think one of the things that I often discuss with patients when they receive a diagnosis of Parkinson's disease in my clinic is we have to discuss the unenviable prospect that unfortunately it's a progressive neurodegenerative disorder, meaning that over time things will potentially deteriorate. I think, however, it's important at the outset to say to patients that there are lots and lots of potential interventions, both through seeing various therapists and as part of the multidisciplinary team, or through medication, which can maintain a very good quality of life for potentially a good length of time. There is a lot of variability in how patients may deteriorate, but there are patients that I have under my care that have had Parkinson's disease for many decades with a good quality of life because they are on the right treatment for them, seeing the right therapist and supported by the right team.